Joyce, maybe I'll ask you, why are we seeing, why are we seeing so much liver cancer?
Yeah, it's interesting because as we learn more about HCC, we begin to learn that there are so many factors that contribute to this idea of progression to cirrhosis. And then, of course, once cirrhosis occurs, a likelihood of developing HCC. And so I think that African Americans have a number of both sort of individual risk factors that can potentially contribute, to development of cirrhosis and HCC in terms of, sort of comorbid, liver disease, for instance. And then you think about which can, again, accelerate progression to cirrhosis and development of HCC. And then you think about and I'm talking about things like, diabetes, or any kind of substance abuse like alcohol, substance abuse, hypertension, obesity. These are factors that can contribute to that. But we also know that, to the point that Kim touched on earlier, screening. And the idea that if these individuals are not getting appropriate screening, they present much later. And that certainly limits our treatment options. If found early, these patients can do fairly well. We have a number of options for treatment, including transplantation. And that's a whole nother discussion in terms of disparities there. But we also know that with liver disease, it's very divergent. If you're very early, you can do quite well. But if you're late, you do very bad.